friends, today we'll be discussing a case or a type of case which is considered a nightmare for a hair transplant surgeon, because these are areas which have extensive baldness with less donor area and curly hair. So all the difficulties, extensive baldness, less donor and curly hair. So these are called the most difficult cases so far hair transplant is concerned. So today I'll be showcasing the case of one of my dear friends and who I am very thankful that trusted us for his hair transplant and also agreed to showcase his case study. So here it goes. So these are the pre-op pictures, and if you see, it is clearly the extensive baldness which we called beyond grade 6. Right? Big area to cover, lateral side humps have gone down, a big surface area of the scalp and a full baldness. And even the donor area, if you see, is wavy and curly. So these kind of donor areas are considered difficult when it comes to perfect eye. Another difficulty that the patient does not want the FUT procedure to be done. So all we had to manage was through the perfect eye technique, which is basically a modified FUE. So we had limitations. We had to cover a big area. We could not do FUT. We had to manage grafts in FUE procedure, and the hair were thin and slightly on the wavy curlier side. So what we planned? See, ideally, if you see the extent of baldness, ideally we would want to put 10,000 grafts in such patients because it's a huge area to cover. And this would be roughly 300 centimeters square of baldness, maybe more. And even with a density of 25 grafts, which is like bare minimum density, we would still need 7,500 grafts, which is not possible using only the FUE procedure in such kind of donor areas. So what we planned for him was around 5,800 grafts over 2 sessions using scalp and beard hair. Again, we could not use body hair because they were not a lot and they were very thin. So scalp and beard hair were used over 2 sessions, and this is what we achieved. So believe it or not, this is what we got. This is not a pad, this is a purely hair transplant result, but with certain tricks. So just with a hair transplant, a plain hair transplant, only hair transplant, will not give us this kind of result. So we'll talk in detail of what we did, how we did, and how come after 2 years this person is looking from here to here. Now, the first surgery, so as I told you, the surgery was done over 2 sessions. First procedure was for the front. We used roughly 4,000 grafts. We did around 3,500 grafts from the scalp and 500-600 grafts we took from the beard, and this is what we did. So we reached from here till here. This is 8 months after his first transplant. So nothing else has been done. Hair transplant and just a hair transplant, and this is how it looks after 8 months. It's better than bald, but not very neat because the hair is curly. We have a curly nature to the hair and it has grown curly, less combable. But this is how it is. A top view. We have managed a good top view, reasonable density. The area is getting covered, but it's not looking very neat. But what about the crown area? Side views looks okay because the front has been covered nicely, but the challenge is the crown area. So because we have already planned this procedure in over 2 sessions and gap was around 8 months, this picture is taken just before his second transplant. The front looks okay, but the crown is better than before. There are some hair, but scalp is totally visible because we have just put 500 or 600 grafts over his crown area. So a big crown which was totally bald, and of course medicines can't do anything here. We have done some coverage. We have put 5 because we got 500-600 extra grafts than what we planned. So we put those hair here. The front is nice, fluffy, well covered. But this area, some hair has been transplanted so that you don't have a full patch. So this area was covered in the second procedure where we did around 2,000 odd grafts using predominantly beard hair, some scalp hair, and covered this area also. Now we did around 2,000 grafts for him using predominantly beard hair, some scalp hair, and now we'll showcase you how it looks 1 year after his second transplant and around 20 months after his first transplant. And mind you, this will not be just transplant. We use certain more things to make it look better, and we will discuss that now. Before transplant, after first surgery, and then 1 year after second surgery. So here you see the curliness of the hair is gone. So this is the simple salon treatment. We call it the keratin treatment. It's pretty common these days. It's not very damaging to the hair root, mind you, and I'll make a separate video on keratin treatment for hair. its pros and cons, but we asked the patient to do the keratin treatment and thus giving him a better combable hair. Why we wanted combable hair? Because though we have given him a good front, but his crown is still lacking hair. It's better than bald, but scalp is still visible. So we wanted him to have a good combable hair, which he can comb and do a back brush. So this front area is getting covered by the hair from that area. But his vertex area, the crown area, is getting covered by a few hair that we have planted on the crown area and the length of these hair. So you see, this is the top look. Bald, good hair, but not very combable. But then after a hair smoothing keratin treatment, the hair has become nice and combable. So this is the illusion that a better combability gives. Because though we want that even if we have extensive grade of baldness, even we have less donor area, after a transplant we should have hair everywhere. That's a wish, but it's not feasible. It's not reality. It's what we call unrealistic expectations. But we have certain tricks, we have certain illusions that can be used to give you a better outcome, to give you a better look. So good hair smoothing, a good combable hair which is brushed in this way, left to right, so that the volume of this hair works good for that area, but also is giving support to the back areas which have less hair. So this is the top view. These two pictures are taken around 20 months apart. Even the side view becomes so much better because now it's looking so neat and so very well combed. Of course, we will see that why there is less density on the hairline, because again we have less donor. We have covered a 300 centimeter square of baldness with less than 6,000 grams. So this is on an average, we see this is a density of 20. On the front it is 30 grams per square centimeter, and then as we go back we have reduced it even further. So this is why, though we want a very dense hairline, but we could not give it because we have less donor, but it is so much better than being bald. Of course, here, now baldness is not a disease. You don't need to treat baldness. Many people are so comfortable, they look so good and they carry themselves so very well with their bald look that they don't need anything. However, if baldness concerns you, if it bothers you, then we have a solution for that. Now, this is the picture that I wanted to show you. Before transplant, around 8 months after his first transplant where some hair has been put, and then after densification and covering. So see here, this is the area which in itself has less hair, and if you see closely you will see the skin, but it is looking so much better than this, so much better than this, because the hair coming from the top, these hair, they are getting brushed like this and it is giving us a nice coverage. So this is the trick which we ask our patients who have extensive hair loss and we have a less donor area. So this is what our patients do and it looks very well. About keratin treatment, it's a salon procedure, it's not a medical procedure. It is not rebonding, it is slight hair smoothing. If done properly using formaldehyde free agents, it is safe to use, but it's not everlasting because it treats the hair that is above the skin. The new hair that grows from inside the skin is still the same. So mostly people who are using keratin treatments do it around 4 to 5 months time. They keep repeating it if they like the result. And again, this is a direct comparison because in this area we have not done a second transplant. So this and this is a direct comparison. No extra hair has been planted here after his first session. The second session was only on the crown. So this is a direct comparison that how much it looks better when the hair is not very curly and you have combed it. It looks neater and it looks fuller. So that was it about this case, which I was very, very happy to share with. And again, I want to thank the patient that he agreed to share his story with us and with all of you, because this was something interesting that even a person who has an extensive hair loss can be managed through a hair transplant with certain tricks, with certain illusions, and overall we get a much pleasing result without the need of any makeups or any concealers. So thank you very much. I hope you liked this case, and if you have any further comments, please feel free to ask us. Thank you.